All right. We are live. Okay. So we are live on Facebook now. I'm sure we're going to be able to share it on the different um, platforms. Hopefully. All right. So I see that Dr. Chumisi is on. Dr. Ankra Charity, she's on. All right. Somebody invite a friend to invite a friend. Invite a friend to invite a friend. Tell them that we are live. We are having an interesting conversation tonight. Interesting. All of our topics are interesting, but tonight, amazing. I can't wait. We have our awesome doctors with us, and we are going to learn. Let's learn. What do you do when your husband's Peter? It's okay. No offense, please. That's another name that people call it. What do you do when your husband's Peter? It's like that of a baby.
Yeah, this one is new. Husband's Peter.
We've learned something new tonight. Well, when I saw it too, I was laughing. I'm like, oh wow, well, I didn't know that's another name for it. Yes, what do you do when your husband's Peter? It's smaller than, or smaller, or like that of a baby. And sis, actually, after I spoke with you both, I I discovered that it could be medical, and I think that we should talk about it. Looking at our background, I know that it's not only Africans that listen to the program. We have different people that listen to us. But looking at our background, a lot of things we tend to shy away from, right? And we don't want to talk about it. So what could have been our brother's situation? We're talking about hormonal changes and how it affects our sexual life. But as always, there's a story backing our topic for discussion. There's always a topic that backs our discussions. And so thank you once again for joining. And Pastor John, thank you so much for joining all the way from the northern region of Ghana. It's a blessing having you on. Thank you so much. All right, so invite a friend to invite a friend. Tell someone that we are live. We are live. And we are going to have an interesting conversation. Sis, please, I hope that you have all the information down because somebody needs to know, okay? Someone will be interested. All the things that we have to go through to get this baby Peter stretched out to be able to function. Dr. Charity, thank you for joining. If you can hear us, you're welcome.
Yeah, well, thank you so much. Thank you.
All right, so briefly, I'm going to ask you both to introduce yourself as always, and we keep the ball rolling. It's 6 minutes into time. We have exactly 1 hour. Hopefully, it will be enough time to discuss whatever it is we want to. If not, we're going to come back for a part 2. But my dear Dr. Sofumami Kankam, please introduce yourself. Mensa, let me say, why did I say Kankam? Sofumami Kankam Mensa, please introduce yourself. Ebo?
First Lady Mary, thank you so much once again for this opportunity to come on here. You always have the juiciest topics and I love it. I'm all for it. So as she mentioned, my name is Ama Kankam Mensa. I'm a family nurse practitioner. I am a wife to one husband. I am a mother of 2. And I'm just a woman of God. I love to study. And so today that helps us to this point. And also I believe that'll be of great help to the discussion that we'll have later on today. That is all.
All right. Thank you so much. Dr. Charity, please introduce yourself for us.
Right, okay. So good evening to everyone. My name is Dr. Charity Chumesianka, and I'm the CEO of Chatma Herbal Health Center. I'm a neuromuscular therapist. I work with the nerves and muscles. And then I also practice Korean hand therapy. That's what I do. Korean hand therapy, and I also practice acupressure therapy. So basically, this is what I do. I'm married to a pastor. I'm also a pastor. And I have 2 kids, all boys. Yeah, so basically, that's what I do.
Well, we're probably going to end up turning this session to some warfare, prayer, spiritual. Yes, it's a blessing, it's really a blessing coming together with such a great body. And I really appreciate you all so much for always being with us, and responding to us whenever we call onto you all. Thank you so much once again. All right, let's keep the ball rolling. My name is Lady Mary Boadu. She says she is married to one husband. I am also married to one husband. That's just by the way, yes. So I'm married and I have 3 children. Your host for the chat room. The chat room is a place where we come together to discuss the daily lives issues, things that are happening in our marriages and our relationship. And we always hope that every issue that is being addressed here would be a learning platform for every one of us. I always say that we are always learning. It's a learning platform, and we do pray that everyone that comes in or listen to us or have the opportunity to listen to us will also pick something from any of our discussions. And so thank you once again. Now tonight, as always, our discussion is based on an issue that has been brought to our attention, okay? And that is why we are here to discuss her issue, along with how hormonal changes affect our sexual drive. All right, so to the story for tonight's discussion, we have a young woman. She's watching, okay, listening in, and I like for them to come on board and listen, so that they are on listening to the advices and things that can be provided to them, the resources and things like that. So she's been married for 6 months, and for the past 6 months, her husband has not been able to touch her, that is sexually. He has not come near her. He's been given excuses. Please share and share and share. If you're on Facebook, if you have access to Facebook, please share. Someone needs to hear this, okay? It's juicy. I'm laughing, but it's not funny. It's an important issue that needs to be addressed. So please, she's married for 6 months. 6 months, the husband has not been able to touch her. Okay, now he's not made any advances or anything on the woman. And so this woman, being newly married, she's sitting there thinking, oh my goodness, what could be happening? What is going on? What have I gotten myself into? She's questioned the husband several times with no response. All right, so she said that one of these days she just decided, well, I'm just gonna barge on him one of these days while he's in the washroom, just to have a look. Let's see what's happening. And we know men, a man is a man. I mean, there's no way she's a beautiful woman,
Right.
I mean, how can you not make advances and
she has
want to press some buttons and do some stuff, But so with that said, she bashed into the bathroom, and lo and behold, she said that what she saw was like that of a baby's penis. I believe that is why the man had shy away so much, on being able to go to her, on being able to approach her. So we thought it wise that we come on board tonight and discuss this issue. Again, when she reached out, believe you me, I reached out to our doctors and I was asking questions. I was looking for all sorts of doctors, and since Amakankan was laughing at me, I'm like, I'm serious, because I want to be able to get some help if there's help available, right? All right, so that is the story behind our discussion for tonight. It's an interesting story. I don't know if I should say it's sad. It would be sad in terms of 6 months. Come on, if she lived in somewhere like Canada or in Ohio during winter time, oh yeah, no, but sure no, because wouldn't be, But that is the story for tonight. Now, first of all, let me ask, what could be, is it normal, our sister Amma, is it normal, and then I'll go to Dr. Cherry, is it normal for a man to have such such small pennies, or a baby penny?
It depends. I mean, I wouldn't say it's normal, but it depends on the type of man. What's the size of a man? Because normally, the size of a penis most of the times has to sometimes do with the size of a man. So the first thing is that what is the size of a man? That's one thing. Now, if the man has had these size of a penis from infancy, then we will say that probably he had a deformity whilst growing up. That is why he might have the penis that's little like that of a baby. Now, when he realized that he has that, what has he been able to do about it? Now, one of the questions we also have to ask is that if the size of a penis is like that of a baby, can it erect or it can't erect? That's one question we need to ask. Does the penis erect or it can't erect? If there's no erection, then it's a whole big problem. But if it can erect, then we are good to go. But if it doesn't erect at all, then there's a problem. So the size of a penis normally depends on the size of a human body. If hello, can you hear me?
Yes, we can hear you, doctor.
Right. Okay. So
okay.
Right. Okay. So basically, the size of a penis has to do with the size of a body. So we have to look at the size of his body first. Is he a tall person? Is he a short person? Is he a medium person? We have to look at all that, and then you can say that, okay, so the size of his penis is just to the body, or the body is bigger than the size of a penis, then there's a disformity. Now, we also have to look at if the penis can erect or not. If it cannot erect, then there's a problem. Sometimes if the penis can be small, but it will definitely erect. It means that, and you see, when it comes to, most of the time, when it comes to sex making, it has nothing to do with the size of a penis, but it has something to do with the sperm that is coming out. Is the sperm fertile or the sperm fertile? These are one of the things ladies must be looking out for. But most of the times, because we've had probably you had an ex who had a bigger penis or something, and then you are married to somebody else who doesn't have a bigger penis. Sometimes you are like, okay, oh, wait there, I say, so mommy, it's not what I'm looking for. That's one of the problems sometimes we find ourselves in. But the most important, because if you look at the Chinese, I have worked with Chinese for years. If you look at the Chinese, they have small penis, but they are able to make sex.
Hey, really? Yeah. A lot of them have a lot of babies. Yeah.
And they have a lot of babies.
So when you say that, that's I'm coming to you. When you say they have okay, let me ask a question to our sister, our doctor here, and then Dr. Ankara, I'll come to you. So please, sis, let me ask you this: if the man was born like that, could the doctors not have addressed that? Sister Amma, can you hear me?
Yes, I can hear you.
If the man was born like that, from the instances or for the description that Dr. Ankara is given, if the man was born like that, couldn't they have addressed this?
Mm-hmm.
So, based on the first question that you asked, you said, is it normal for a man to have such a small penis? It's very rare, but it does happen. A lot of situations that I've encountered could be men who, let's say, they have diabetes, they have high blood pressure, they have mental health issues. A lot of times the medications that we give them can play a role on their hormone, the main one being their testosterone. The testosterone levels is pretty much like a sex hormone. So certain side effects of medications can affect that. Now, when that's affected, it can affect how they enjoy sex. It can affect their libido, which is like their mood for sex. It can affect their energy. A lot of times too, weight gain can influence that. Having a sedentary lifestyle, meaning that just not caring, eating, whatever kind of goes along with the weight gain. So those are some of the things that can affect the person's hormone, and, you know, also in essence can affect their sex drive, can affect their penile size. However, it's not very likely. Now, depending on when they came to realization of it. Now, you have to know that men, unlike us women, we see one uncommon hair, we're running to the doctor. We see one uncommon issue, we want answers, right? But men, because of one, their pride, because of our culture, it's not a subject that they want to talk about. You know, a lot of men don't want to go in front of another doctor who is a male or female to say that, hey, I think I have a small penis. What can I do about? But rather, they will probably try to go on the internet, try to find, you know, stuff they can buy online, try to find other things that they can do so nobody knows their big secret, because it can be embarrassing, you know, especially as a man. That's one of the things that men take pride in. That's one of the things that builds their ego. However, if in the if events that he had perhaps talked about it, you know, growing up, there's not a whole lot. We will talk about, you know, different equipment that you can use and stuff to help, you know, but it's not a whole lot that can be done, because one, it could be genetics. Believe it or not, small penis can be inherited. You know, so it could be genetics, it can be hereditary, you know, all that play a role. But there could have been, like, you know, some herbs, some natural things that he could take, just like our Dr. Ankora was saying, that would have helped him along the way. So even though it's smaller, he would still be able to have an erection, still be able to produce babies, that kind of thing. Can you all hear me?
Yep.
Okay. I think Lady Mary's line is paused.
Oh, okay. But you did a good job.
Thank you, doctor. So we're waiting for her. As we're waiting for her, for those who have tuned in, welcome. We're talking about hormonal changes and how it can affect your sex drive today. I think our host is having a little bit of technical difficulties. I see her popping in and out. So please don't leave. It's going to be fixed momentarily. Just give us a second. Where we have ended, if you have any questions too, you can go ahead and unmute yourself and ask, or you can type it in the message box and we will read it. If you're shy to, you know, ask your question on here. But this is all a learning experience for all of us. So please share your ideas and everything, or your questions. Feel free to do so. Dr. Ankora, please, is there anything you wanted to add?
Yeah, ma'am, I think you said a lot, and it was one of the things I was going to talk about, especially with the BP medications and diabetes. It was one of the things I wanted to talk about, because most of the times it affects a lot of our men, and then making their sex drive become a challenge. But like I was saying from the beginning, the most important thing is that it has to be able to erect. And then one of the most important thing is that the sperm that is coming out should be that strong to be able to produce a baby. If that is not happening, then there is a bigger problem.
Yes.
Then yeah, then there's a bigger problem that we have to look at. But if the penis, irrespective of the size, can erect and still have a good flow of sperm and the count is good, then the woman don't have a problem. But if he can't do any of these things, then she has to this one we can't say do.
Yeah, but I think
We have
just
to make a means of making babies, or probably they have to look for ways and means of satisfying themselves. And you see, this is where the heaviest challenge comes in, because at the end of the day, you're already married to the person. Leaving them becomes a problem because
yes.
of society is going to say how you feel and stuff like that. And I believe from the relationship, if they were discussing, I mean, a lot, I'm sure some of these things would have popped up and they would have been able to discuss about it. And the man will be able to come up to say that, okay, I have this problem or I have that problem. And Dr. Mensah, like you were saying, you know, most men will not want to go to the hospital, irrespective of what they are feeling.
Exactly.
They are not like they're not like women who want to go to the hospital on every little thing. Most men feel shy to go to the hospital to say, I have one problem or the other. So they keep it to themselves. But one thing that they should know, I believe there are men here who are watching us. One thing they need to know is that once you have a problem and you shy away from it and you can't say it, then it means that you don't even love the woman you're living with. Because at the end, if you cannot satisfy her, that also becomes another problem. You know, so it's a big deal, but
a dicey issue. So thank you so much, Doctor. Somebody put a question here. It says that how do you know if you have it says how do you know if your sperm is strong?
okay.
So I believe they're trying to say if you have like a low self sperm count or not. Yeah. So one of the things I think we mentioned a little bit is whether you have like a low self sex drive. That's one of the things. Whether they're struggling with having an erection. Sometimes too, they can have pain, swelling, or lump in their testes. Some may have visual effects such as like facial hair not being there. They may have like hormone imbalances. Some of the ways that here in the States they can test for it too is actually, I don't know if it's done in Ghana too, but sometimes they will have the men actually ejaculate into a specimen cup. And that is how they measure, you know, how their sperm cells, they'll measure it to see, one, is it a lot, is it strong? And if in that event, let's say they find that it's not, there are things that you can do. There are hormone replacement therapies that the male can take to help. But a lot of times too, it can be helped just by natural things like watching what you eat. Remember in the beginning, I was talking about how what you eat can affect your sex drive, can affect your hormones a great deal. So me, I'm the type of provider that when you come to me, coming from Africa, we try to do everything natural. So before I go to medication, I will always try to see what you can do naturally for yourself or what the body can do naturally on its own. So before I recommend any kind of medication, I would suggest that, okay, how's your eating? What kind of stuff are you eating? Because the person can be skinny and still have like high cholesterol, you know, have all kinds of, you know, issues, blood pressure, all of that. So the first thing I would look at is, okay, how are you eating? Are you exercising? You know, how is your sleep? All that stuff is stuff that you can kind of mend to help. Are you drinking? If you're drinking a lot, believe it or not, alcohol can play a role too on your hormone levels, you know. So are you drinking? Okay, you need to stop drinking, or you need to minimize your drinking. You need to exercise more. So there is a lot of things that you can do naturally to kind of help boost your sperm count, to kind of boost, to make sure that you have strong sperm count. And if it does not happen, that is when, again, as I was saying, we will resort to medication. But again, I'm the kind of provider, and I believe probably Dr. Ankwar is the same way, where we believe in trying to start naturally. And then when you can't do for yourself, that's when we put you on medication, because medication can in itself also cause a lot of side effects.
Yeah. I think
Dr. Chumesi, please go ahead. Go ahead.
Right. Okay. So I think Dr. Mensah has said a lot. In Ghana, especially at my clinic, I have a machine that can check your sperm counts in a minute. I mean, without even going to have to take your sperm out, it will just check from your brain and everything. And that's a machine I use in my clinic, where you'll be able to know the semen volume, the liquefying time, sperm motility rate. So basically, that is what I use here. And then I have a lot of natural remedies for sperm boosting. So I think I would have to give a few of that to help our men here who are watching us. Can you hear me?
Yes, we hear you very well.
Right. Okay. So one of the things that if you're a man, one of the things that you have to be eating most is watermelon, the seed and the back of it. So you can blend all together, watermelon, the seed and the back. If you have turmeric, you can add turmeric to that, and then you can take it as a drink. It will help your sperm count. And then another thing is if you can have mangoes and cloves, that can also really help your sperm count. Mangoes and cloves, it's just like a natural aphrodisiac that you need to take as a man. You don't have to joke with it. So these are some of the things that can help your sperm count boost. And then, like you were saying, what you are eating is very important, because what you eat will make you produce a lot of good sperm. And then one of the things that men should also know is that if you're a man, you don't have to go hungry. Your morning meal especially should always be on point. Is very important. It helps you to produce a good sperm. And then another thing that will help the sperm count is our normal oats, our normal Quaker oats. You just boil it. No sugar, no milk, no salt. You take a glass in the morning and a glass in the evening, and that will also boost the sperm count. So if the men are able to do that, I'm sure it will help them a lot with the sperm count. If all these things doesn't work, then we have to add.
Thank you so much for that. I hope everybody can hear me. There was some disconnection issue. I'm not sure what happened, but can everybody hear me okay?
Yes, we can hear you.
Okay. So interestingly, let's say this man, his thing cannot erect. The lady made a comparison. She said it's like a mushroom. That's what she said. I mean, come on, you guys have all tasted mushroom. You know what mushroom tastes like. You know what it feels like. Like she said, it's like a soggy mushroom. You see, and honestly, for her to even come and discuss this, it's not easy. Like you said, Dr. Arma, you said that you can't just be bold enough and go out there and talk about these things, okay? Right, especially for those for Africans, for some people, it's not easy. And so being that it's like a mushroom, okay, it's not erecting. What are some of the things? Now, doctor, you made mention that there's some things, and I'm talking about Mrs. Kankam Mensah. You said there's something that you can implant or put in there, where when you want to have sex with your wife, all you need to do is press the button and it stretches out. And after you are done, you just press it and it goes right back to soggy mushroom. So please let's talk about that.
Yeah, so before you came back on here, we were talking about how, we have natural ways, and we want to make it clear to every woman that is listening, every man that is listening. You can still have a small penis, right? And it functions. You can still have a small penis and you can have babies. So let's get that clear. However, if for whatever reason, you're not able to get an erection, you've tried all the natural ways, you've tried everything, and it's not working, especially for older patients that I've had before. We have two ways. We have some devices that can be implanted or that can be put on your penis to help. I have pictures I'll show briefly. And then we also have there's also, I don't know if I brought a picture of that, but let me go with the devices first. Oh, and then there's also medication. So there's medications such as Cialis, there's medications such as Viagra. Now, it wasn't up until I started practicing, I realized that actually a lot of young people are starting to use it. It used to be when you said Viagra, it was only for like the older population, maybe somebody in their 60s and stuff like that. But right. But if we look now, young men are having diabetes, young men are having psych issues, young men are having blood pressure issues, like I was mentioning earlier. And a lot of these medications can cause them to have low self-drive. And sometimes they don't even need to be on medication, but because of, hey, they want to be like they were when they were 17, by force, they would jump on medication. That's why I personally like to do everything natural. But okay, so without talking too much, I hope you all can see, I was able to print some of the devices. Let's start with this one right here.
Hi.
This is, don't make me laugh, Mary. This is called a penis vacuum. So if you can see on here, this is the testes, this is the penile shaft, and it works just like the name, is self-explanatory. So what it does, you put it on kind of like you do a condom. You see how this tube right here is on the penis shaft? There's a button on here, and then underneath there's another latch. So the male would just put it on kind of like you're doing a condom, but it's an actual tool. They will push this, and then the vacuum will kind of stimulate them and cause them to have an erection. Now, once they are done, just like anything else, so they will move it once the erection is there, and they should be able to function. Now, these are the males who are in the early stages of erectile dysfunction, so they can use this as an aid to help them to kind of achieve that erection. However, when they get to a stage where that device I just showed you, the penis vacuum, is just not gonna work, then we do what we call an invasive procedure, where I don't know how good you all can see this. I had PowerPoint, Mary, but I saw that you blocked sharing PowerPoints. So next time that's okay. This will work just fine. So this is a penile implant. Can you all see it pretty good?
Yeah.
This device is unlike the other one that I showed you that goes on kind of like a condom. This one is inserted internally, and it has a balloon that kind of dangles at the end of your testes. So really, your partner, you don't even have to tell them. They won't know. Whenever you're ready to have sex, there's a little button here too that you would just push. It pumps your penis up. It causes you to have an erection, and you can function discreetly without anybody knowing.
So question for you, is that done by surgery then, or?
Yes,
Okay.
yes, it is. And the recovery could be different for every, it's different for everybody, but it's not anything that I will say it's, what is the word I'm looking for? It's not like a critical type surgery. It's not something that you're gonna go in and come out dying. A lot of times it's just done even in the clinic setting. Let me read what this said. It says that it's a flexible penile implant that consists of 2 firm and flexi rods. So these are the rods that are put in. Again, there is one here in the penis, in the penile shaft, right there. And then this is the balloon that kind of goes above the bladder. It says that it's placed in the shaft of the penis. There are no other parts to this implant. To have an erection, you simply hold the penis and move it in the desired position. When you are finished, you bend it back down and conceal it. And the malleable penis implant can be option for men with limited dexterity. So again, you know, nobody will ever know. Now today, right before I printed it at work, everybody was laughing like, what are you doing? So I had to explain to them. And they were telling us how, I also work on a long-term unit. And they were telling us how sometimes the disadvantage of having this device is not being able to have it turned off. We have an older patient. I don't know if he just never figured out how to turn it back off. So on his day to day, his thing is still erected. But that is not the normal case. Most of the time, you can turn it back off. This is another kind. I don't know if you can see, this is another one that I was able to print. It says that patient report 97% satisfaction. So it works. You know, this penile implant includes a pair of cylinder implants into the penis. A pump is placed into the scrotum. So this is also similar to the one I shared earlier. It's put inside the penis and the shaft. A saline, unlike the other one, saline is placed in your lower abdomen. Squeezing and releasing the pump moves the fluid into the cylinders, creating an erection. So this one has water in this chamber right here. So this part is inserted into your penis. This part right here has the water that goes under your abdomen. Whenever you want an erection, you push this button here, it inflates the water into your penis shaft, causes you to have an erection. You handle your business. When you're done, you move this part, the water goes back in. So again, these are some options that, you know, are there for you if medication does not work, working out, watching your diet, all that doesn't work. I'll let Dr. Ankar, if she has anything, talk a little bit, and then, you know, I can chime back in as well.
Right.
Wow.
Okay.
Amazing, amazing, amazing. I mean, wow, this is interesting. Dr. Ankar, go ahead. I'm not going to even cut you up. Please go ahead and say what you wanted to say.
I think Mrs. Mensah has said a lot. So the couple can resort to any of the options to help them. I mean, this time around, I don't think we have situations where there are no solutions to it. Once there's a solution to the problem, I feel that it doesn't call for a divorce, but they can go for any of the solutions or one of the options. And I'm sure they can still have sexual satisfaction or whatever. It shouldn't cause a problem. The only thing is that the man should be availing. I mean, he should be willing to avail himself. Okay, that, well, this is a problem I have. So if there's a solution, then let's go for it. This is what the challenge that a lot of women, married women, have. Most men have problems and they don't want to own up. They don't even want to avail.
Right, their pride.
Yeah, their pride, their ego. They don't even want to open up. They don't even want to accept that they have a problem. And then at the end of the day, it's a woman that suffers. I mean, all. So it's a good device, so they can go for it at least to make them have some peace and so that she can enjoy. I mean, having to marry for 6 months and you not being touched for 6 months, come on. That's a whole lot of, I'm sure it would even cause a whole lot of questions and depression and a whole lot up in her brain. So if she has found out what actually the problem is, I'm sure the man should be able to own up that, hey, my wife is true, this is my problem. Then they can go for any options so that have good sexual satisfaction.
Wow, I am glad that we talked about this tonight. Hopefully somebody somewhere that may be going through, this same issue or having this problem. Again, like we said, most times looking at our backgrounds, we shy away from having these conversations, but look at this, their help. And those illustrations, the pictures she had amazingly. But I wanted to ask you, what if someone has the first picture that you showed? What if someone has a penis that is smaller than that? Can it still work? Does it matter the size of it?
It will still work. So the device is only supposed to help you have an erection. It's not for you to have an enlargement. They do have, I forgot to print that, they do have other devices that quote unquote can help make it a little larger, but you're not going to go from having the size of, to say a baby penis to having a 9-inch. It doesn't do miracles like that. So it's pretty much like what you have already. It can enhance a little bit on it, but it doesn't perform, miracles. I do know too, that they have, it's your own personal, I have to be careful how I say this. I don't want my church members coming from me, I beg, but they also have sex toys, okay? Sex stores, not toys, stores that you can go to. These stores, some of them, I haven't tried it, I haven't tried it, but some of them say that they have pills that can help. Some say they have oils that can help in that area. Again, I haven't used that before. I haven't had to in my practice, not in my office, not on any patients. I can't vouch for it, but there are things that people have stated that they've used and those have helped. But again, if that is a condition that you have, I think first of all, we have to realize it's a condition. I think when Dr. Ankra was speaking earlier, she was saying a lot of not just Chinese, Caucasians too, they're just not blessed when it comes to that department, but they're able to function with what they have. So we have to go back to knowing, okay, so this man has this issue. What does he want done about it? Has he agreed to go see somebody? Has he agreed to even go to a doctor so that they can check his sex count, his sperm count, so that they can see what they can do to help naturally? They can see what they can do to help with pills. They can see what they can do to help with devices, so is he willing to even go for help? Now, he has to want the help first before anything can be done, but again, they have to keep in mind that these devices don't produce miracles. It just works with what you have. It enhances it so that, you can perform a little better. If I make myself clear.
Yeah, that's good.
Sister Mary, I think you're muted.
Okay, I'm so sorry. I was asking Dr. Ankra if there are any natural herbs. in Ghana, we say a fomedro. Are there any natural herbs that one can?
Yeah, we have a lot of natural herbs that can help with erection. A lot of them, I have a lot of them in my clinic here that can help with erection. And then another thing that I want to say is that once the man can have erection, irrespective of the size of the penis, if he can have erection, the woman's vagina has been created in such a way that it will fit to any size of the penis. That's one thing we should know at the back of our head, that irrespective of the size of the penis, a woman's vagina has been designed to be able to fit into any size of penis once the penis can have erection. So if it can have erection, it will fit into the vagina. Sometimes we have all these young ladies want to have vagina tightening and vagina this and vagina wash and this, that, and they're like, this penis is small, it can't fit in. But hey, if you look at the size of a head of a baby that can come out of vagina, it tells you that the vagina can accept anything that comes. So if the penis is even small and can erect, the vagina will adjust itself to accept it. That's one thing we should know. So yes, we have a lot of herbs in Ghana here that can help a lot of men out there who are having one challenge or the other.
Okay, thank you so much for that.
And
It's been
just to add, lady, please, just to add to what our doctor was saying too, a lot of times we beat the man up, right? And we say, oh, and he has a small penis. Sex takes both people. Okay, it's two people. The man cannot have the sex by himself. Both of you have to come and work together. If things are not going well in the bedroom, communicate. Say, honey, hey, I like it this way. I like it when you touch here. I like it when you move this way. It's a communication, act. And then women too, let's not be so hard on the men. I know that we want the big ones. We want it to rock our world hours and hours. That's not practical. As women too, as we get older, we realize that our hormone levels decrease, our estrogen, our progesterone, all that decreases, and we become kind of like the men in essence, because all that affects our vaginal dryness. It can cause sex to be painful. It also affects our libido, when we get older. So please, if you're a woman on this line, don't be so harsh on the men. And kind of know that when we go through our state, which is called menopause and premenopause, we also face similar issues, so please don't beat our brothers up. Men, they want to be praised, especially when it comes to bedroom matters, so please, let's not beat them up so much. Encourage them. If there's an area that they're lacking, try to see how you can tweak things. Have fun in the bedroom, communicate, and don't be so harsh to put the men down and affect their pride. Yeah, that's what I want to say.
The issue with our sister too, if the man would have probably communicated, okay, I was actually telling somebody today that I think that when we are getting ready to get married, we must probably start talking about sex. I mean, if you wake up in the morning and your thing does not erect, you should be able to let me know. I'm not saying go out there and have sex or whatever, but prior to marriage, okay, do you erect? I mean, let's find a way to ask questions, because you're gonna get into it like this woman, 6 months of marriage, and you've never been touched. That just doesn't make sense. And so I think that these are things that we should really communicate about.
I was acting as when we're getting married. I mean, getting to about 2 weeks to our marriage, he was the first question he asked my husband, hey, have you been circumcised? Do you erect? I mean, our counselor was straightforward. Do you erect? He asked, and I think it really helped us, because at least what we are going in.
And I don't think we should shy away from that, especially, I mean, come on, this thing was created there's a reason why it was created. And so if you're going to go into this marriage and not sign your life away and not have to enjoy a bit of it, I mean, for 6 months, for Christ's sake, I mean, if he can erect, or if he can do his business and maybe he's travel and things like that, we understand that, but not the case whereby it's like she mentioned. I mean, it's not, the there is not there, and you're not communicating with her. So he's rather harming this lady. It would have been, I think this thing could have been so simple. It would have been both to just come to the lady and say, listen, my wife or my wife to be, I do not erect. My thing is as small as this. This is a woman that you're going to spend the rest of your
life with. Yeah.
You should be able to communicate with her and let her know how small your penis is, whether it erects or if it doesn't. And so for 6 months, I'm glad that she actually opens up, and thank God that she's online listening. These tools, can we talk about prices? Are they expensive? I mean, please share. Are they expensive if you know the price ranges? And I want Mr. Chumi also to share the natural herbs part. How much does it cost? How many or how much would they have to take before they start gaining some weight in that area? Please, Amma, go ahead.
Okay, so as far as the penile vacuum, which was the first one that I showed you, I don't know the exact price, but it's something that can be recommended by your doctor. It's not anything that's going to cost like thousands of dollars. However, having the penile implant, that is surgery. But if you have the diagnosis of erectile dysfunction, those kind of things, we have a way to tweak it where your insurance will cover it. So if you have good insurance, it's a, medical procedure, just like you would go to have, let's say, knee surgery or, hip surgery or something like that. So a lot of times they will pay for it anyway. So it's not something that they should worry about. Once you're actually diagnosed as having erectile dysfunction, now don't come there only because you are you have a 5-inch penis and you want a 9-inch. Now that it's not going to be paid for because that's going to be considered plastic surgery. You would have to come out of your pocket. But if indeed you have erectile dysfunction, then it can be done. There's a question that somebody posed in the chat. They said that can these tools have some side effects? So yes, just like with everything else, after having a penile implant surgery, you can expect like mild to moderate soreness for a couple of days, just like with any surgery. The symptoms should go away, and then you should be able to be back in business, hopefully about a week or two. However, as I was mentioning earlier, if you get too excited and you keep turning the device on, and it breaks down, that is when you have what I was saying with one of the patients that we have, where it's like they stayed erected forever. But you can always go back in and, that can be fixed. It's not like to walk around that way. But yeah, it does have side effects because it's surgery, just like anything else. But it's not any kind of surgery that will cause death or anything like that. I haven't heard that before. Yeah, but you can experience soreness.
Dr. Chumesi, before you come on, I'm going to ask you a question. What should be the normal size of the pennies?
Mary, you're not serious.
No, what should be?
Yeah.
It's important. Why are you making happen? What should be? It might be a good question for someone that is not yet married. Yeah. Dr. Chumesi, please, I see you're laughing, but I want to know what should be the normal size of a penis?
Water on that one.
Size of the penis it differs from person to person. That's what I can say. It differs from person to person. So depending on the size of a body will determine the size of a penis. But at least between what should I say?
5 to 7 be very normal.
5 to 7, that should be okay.
Between 5 to 7 inches? Or
yeah, 7 inches is not bad.
So these things, do you use normal ruler to measure it, or there's a specific ruler to measure this?
I haven't measured anybody's penis. I don't know if Dr. Mensa has done.
No, I have not. I think it's more so gauged in the eyesight, yeah.
I mean,
but I want to say this though, Lady Mary. Please, females, especially females, okay? The size, somebody can have a 10-inch penis and not know what to do with it. Let's be very clear.
That's
and
right.
Somebody can have a 2-inch penis and know how to work it. Okay, that's why I was saying that it's very important that when you are married to somebody and you are intimate, communication in every marriage on every level is very important. Communicate with your partner. Say, hey, this is how I like when you move it. This doesn't work for me. This works. That, touch me here, do this, all that. Because sex in itself is not just about just poking, pam, and then a couple of minutes. So let's look at it from that angle, because I think that's where a lot of females come from. They just think, oh, if I have a man with a big penis and I'm going to be satisfied. It's such a wrong myth. Average size, it's going to be fine. Communicate and make your marriage and your sex life work for you. Everybody's sex life is different. I can't use mine to tell you what to do because you don't have my husband, you don't have my partner. Make your sex life work for you. If that makes sense. Yeah.
Thank you so much. Dr. Chumesi, please come back to your, I was asking if the prices and, in case if somebody wanted to, the natural herbs. Please go ahead.
Okay, right. So the natural herbs are not too expensive. I don't know for other herbal hospitals, but my clinic is not expensive. But before we give out, we run a test to know what is actually happening in the man's system. We should know the sperm count. We should know the level of the erectile dysfunction that he has. Then we'll be able to know that, okay, this amount is okay or that amount is okay. But trust me, the person will not spend more than 300 cedis if the person should come to our clinic. So we'll be able to take care of it.
Thank you so much for that.
So please share, maybe when we get off the live, you can share some of your herbal secrets with our lady so that, you know, in the future I can make some recommendations too. Yeah.
Yeah, thank you so much. So let's talk about hormonal changes. What does that mean when we say hormonal changes? Dr. Chimesi, since you're talking, please come in. What does that mean?
Okay, so hormonal changes happens a lot to especially both men and women, but especially to the women. It has to do with our day-to-day activity. It has to do sometimes with our mood. Most women, the moment we have mood swings, automatically our hormones will also swing. And sometimes when our hormones swings, our mood will swing alongside. And most of the time when we have hormonal imbalance, sometimes it affects even our menstrual flow. And then sometimes it can even affect our sexual drive as women. I always say this to women, that you always have to keep a positive attitude. One of the things that really affects our hormones is stress. When you are excessively stressed, if your job is stressful, the possibility that it will affect your hormones is very high. So you need to be make sure that you distress a lot. Exercise is one good thing to put your hormones on track. Most people don't exercise. We see exercise as one difficult thing that we can do. And then sometimes the things we also eat, one way or the other, can also affect our hormones. And then once it affects our hormones, the possibility that your sexual drive will decrease is very high. So as women, what we are eating is very important. Exercise is important. Too much of anxiety, we have to be careful. And then we also need to do a lot of exercise to make sure that our hormones are in check. We need to have a positive attitude to make sure that our hormones are in check.
Okay, thank you so much. My lady, Mrs. Kankan Mensah, somebody mentioned that hormonal changes only had to do with people like with new babies. Can everybody hear me?
Yes.
People who little baby, like people who are women, especially who have just given birth. So are we saying that there's no truth to that or not necessarily?
With any stressor to your body, when you have any illness, any new activity, it can affect your hormone. But I want to start off by just adding to what our doctor just shared. What are hormones in general? Once you get, you know, what the definition really is, you can also kind of get a better idea. They're pretty much just chemical messengers in our brain. They help monitor and help with the function of our general health. They help with our sexual drive, our reproduction, which I think is the part that you are talking about. Hormones can also help influence our body weight, our hair growth, our muscles, and definitely our sex drive, which was the other part that we were talking about. However, when a woman does have not just babies, when we go through any life medical issues, it can play a role on the estrogen, progesterone, which are the two main female hormones. It can cause it to low. And a lot of times that is when you find women going into pre-menopause, you know, once they're their hormones are lower, the estrogen, the progesterone, and even women also have testosterone. That's a male hormone, but we also have a part of it as well. So when those hormones are lowered, that's when, as our doctor was saying, it can affect your sex drive, it can affect your energy, it can affect the secretions that even your vagina makes. And that's why a lot of women, they go through premenopause or they're in the menopausal state itself, the full-blown menopause, they're like, they don't want to have sex because sex becomes painful. The drive for sex becomes low, so low libido. However, as we were mentioning before, we have what we call estrogen therapy. We have vaginal creams that can help with that. We have medication that you can take that can help bring your levels back up so that you don't go through that situation.
What are some of the creams? You said creams. I'm interested. What are some of the creams that you're talking about here?
Okay, so we have, let me see, do I have an exact name for it? But they're pretty much, they're called estrogen therapy. So what the cream in essence will do, if your estrogen level is low, that can be found through blood work. So then we have a cream that has like estrogen contents in it so that when you apply it, it kind of stimulates you where you won't be as dry. It also boosts up your levels.
These are like over the counter?
No, they have to be prescribed to,
Okay.
they have to be prescribed to you, yes. And then sometimes too, with premenopause and with menopause, you have the hot flashes. You hear a lot of women say, I'm sweating, I'm having night sweats, I'm having hot flash, I'm going from being cold 1 minute to being hot the next, my mood swings, as our doctor was mentioning. So these creams and the medication also help, again, regulate your hormones so you're not, you know, up and down. It helps you to get back to your baseline. And again, like I was saying, we have some topical ones that you can use, and then we have some oral ones that you can take as well. But again, when it comes to the hormones, when I was talking and doing my presentation earlier, I was telling you that a lot of this can also be done. I like to use natural ways. So what can your body do for itself? You know, what can you do for yourself? Okay, you are premenopausal, you're having all these symptoms. Have you watched your diet? You know, are you working out? Have you stopped using drugs? Have you stopped drinking alcohol? You start from there. And if after doing all that, that doesn't work, then I would suggest, okay, let's try, you know, okay, if you're saying you're having your during intercourse is painful, have you tried using, you know, lubricants and stuff like that? If those don't work, that's when I would jump in and say, okay, let's try the creams, let's try the medication route.
Dr. Chumisi, please come in.
Okay, so like Mrs. Spencer was saying, one of the things that also affects the hormones, especially with the women, has to do with excessive intake of fatty foods and spices. That's one of the research I made with some of the women that come to the clinic and they complain, my menses is not flowing well and stuff like that. And it was one of the research I made to see that most women who take a lot of fatty foods and a lot of spices, they're not the natural spices, but the artificial spices, mostly affects their hormones, and so it makes the blood flow becomes a bit of a problem. And then when it comes to hormones, that has to do with your sexual drive. Like Mrs. Mensah was saying, sex is a two-way thing. If you don't put yourself into it, you are not going to enjoy whatever comes out of it. So you need to put your mind on what you're doing, or else you can't have anything. So if you're a woman and you are taking a lot of oily foods and a lot of artificial spices, I would ask that you be careful. And then one of the things that you can do as a woman to put your hormones back to normalcy is to go on a warm water therapy for a month. warm water first thing in the morning, last thing to bed. If you can do that for a month. Lady Mary, your mic is muted.
I was asking if you're referring to drinking it morning and evening, or?
Yeah, drinking warm water morning and evening. So if you drink warm water morning and evening for a month and you reduce the intake of oily, fatty foods and spices, the artificial spices, and you go on warm water therapy for a month and you add cinnamon powder to it, automatically you will be able to have your hormones back to normalcy. And then some women also sometimes a lot of contraceptives also affect their hormonal changes. So it depends on what you're using. You have to be sure which one fits your system, and then you can do that.
Yeah, as far as the contraceptives, I think I put that in there as well. Some women, when they're younger, let's say they have irregular periods, so they start from a young age taking contraceptives, so that by the time they are married to childbearing age, so it causes their hormone levels to be decreased, and that can also cause them to be in a state of early premenopausal, early menopausal state. So they can have these symptoms a little earlier because they've been on these contraceptives, which have some hormones in them as well. Also, a lot of women who smoke and drink, that can play a huge effect. That's why when I was talking earlier, I was saying that it's good that, you know, when you find out that this is going on, you try to tweak things naturally first and then see if it helps. And like our doctor was saying, yeah, drinking warm water, I learned that today, and cinnamon, you know, those kind of remedies you want to try and see if that will help.
Amazing discussions tonight. Does anyone have any questions? Those on, someone have a question on Zoom.
Yeah, I posted a question. If tubal ligation causes hormonal changes in women.
Doctors, take this one and then I will chime in.
Okay, I'm not sure if she's connected, but I see she's on, so you might have to. Dr. Chimesi, are you still with us?
Yeah, I think my line just went off a bit.
Okay, please go ahead.
Okay, I didn't get the question.
Oh, please ask your question again, madam.
Yeah, I was asking if tubal ligation causes any hormonal changes in women.
Yeah, sometimes it does. It depends on what really is happening, but that can also cause a hormonal imbalance in women.
Yeah, also, yeah, just as our doctor was saying, it can cause a rapid decline in your hormone levels, especially your progesterone and estrogen. But usually after, you know, you go through the healing process, it should be able to come back to normal, because you lose blood. You know, you lose a lot of blood when you undergo that procedure. So that's why it can affect your hormones, but typically it's not something that is long-term or very rare, you know, I should say.
Thank you.
You're welcome.
Does anyone else have a question? If you have a question, please put it in. I'm not sure if anyone has a question on Facebook. I'm not sure what's happening on Facebook, but wow, it's been an amazing session tonight. I'm personally blessed. Somebody said everyone should go home and measure their husbands.
Wow.
It's been an amazing conversation.
I have a friend that contributed. She's shy to comment, but she's on here. And she says, yes, specialists say specialists, not me, she said specialists say that the size of the penis should be the size of a doorknob.
Which type? There's so many types of doorknobs.
Okay, it says that the doorknob with itself wide enough to please us. And it says that, and the man should be more concerned about pleasing his wife, period. I'm not gonna read the rest that she wrote, but yeah, it's supposed to be the size of a doorknob. So
Yeah, but you see, my confusion is that there are so many types of doorknobs though. So I mean, I've seen some real interesting ones. So I don't know. But okay, at least we have a fair idea. We can probably just gauge at regular
Lady
master.
Mary, I mean to that, I also heard by the shoe size. So if the man wears size 6,
that is a lie.
6 inches, yeah. So I have a friend who wears he actually wears a size 8, but when he's going to parties and all that stuff, he wears a size 9 so that the ladies can look at the shoe size. And
a lot of men, because they know women believe that, they will wear big size shoes that, you know, is way bigger. And then women are like, oh, he has big feet, so he has big. That is a myth. I don't know who came up with that. It's a myth. And as we were saying before, even if the thing was as big as the size of their shoe, 9, 10, a lot of people with these big penises, excuse my French, don't know how to even work it. You know what I mean? So it's not all about the size. It's about your sex is all in the mind, and you know, the connection that you have with the individual, the communication you all have, you know. But for whatever reason, our generation, because of TV, we're more focused on the size. But the size is not what causes you to be pleased or to be happy. It's more to it than just that.
Yeah. Thank you so much. So for tonight, I mean, if you didn't take anything away, if you're a married couple, if you're someone that you're trying to get into a relationship or planning to get married, this thing should be a conversation that must have. It's not that you're going in there to sleep with the person, but you must know whether if they wake up early in the morning, they erect when they're lying in bed, you know, does it hook the mattress? The questions must be asked. And then also communication, it's all in the mind. Sex, love making, it's all in the mind. It's a mental thing. Your husband can have the smallest thing as long as he can erect. You can communicate, and you know, foreplays and things like that really does do the job. And so if you didn't take anything away, I've grabbed onto that. And so please, a lot has been shared tonight. I do pray and hope, again, if you can, if you're on Facebook, you can always share the link. I believe that someone will personally be blessed by our discussions tonight. But before we run off, please, Dr. Chimeti, and then we come to Lady Doctor as well. Dr. Chimeti, what are your final words specifically for this woman who said the husband's Peter happens to be like that of a mushroom and it's a baby size? Please, your final word for her.
Right, okay. I want to tell her that she shouldn't give up yet. She shouldn't lose hope yet. Once there are remedies, or once there are options, the solutions that she can go in for, I believe they should quickly go in for that so that they can have a peaceful home. Sex is not only, satisfaction is not only achieved through the penis. I mean, that is one thing she should also know. Satisfaction is not only through the penis, it can come everywhere. So I would ask that she doesn't lose hope yet. All hope is not lost, since we have a lot of remedies and a lot of options that they can choose. I believe
so thank you so much for that. Dr. Mensah, please, I want you to specifically talk about men who shy away from having mushroom-like or baby-like Peters, please, if you can hear me. And more specifically, so that shying away from talking about it. I've learned tonight it is important to talk about it. You let her know that, you know, if it's small, you know, if the there is not there, you communicate about it. If this is a woman that loves and care about you, you know, relationship is not just about sex. And so please, if you're there, I want you to address men that happens to have themselves or find themselves in that position. Please go ahead.
Yes, I think when we first discussed this issue, I was under the impression that they had only been married for a month. I'm now finding out it's 6 months. So at this point, I'm kind of thinking, okay, is he, going for help? Remember in the beginning, I was talking about, especially our culture, being Black people in general, not just Africans per se. Men have a lot of pride, and they don't want to go to the hospital. We women, we see a little growth, we're running into the hospital, we want to know what it is. But men, because of their ego, their pride, they don't want to, but when it comes to things like this, it's not just about the man. It's about the woman, because at this rate, you've been married to her for 6 months. No sexual intercourse, you haven't consummated the marriage. That's the problem. This poor lady is suffering when it's sexually in her marriage. So it's not just about the man. So I think at this point, my advice to her and other women and to men on here, it's not about just you, it's about you, your partner. Put your pride aside, go seek medical help, because there is help out there. There are things that you can do to help, so that you don't continue with this problem. If you're not going, you being selfish. I understand when you're not married and you don't care about it, but once you enter into a marriage, and sex is very important, very vital in a successful marriage. Once you withhold that from your woman, one, you're being selfish. Two, you don't care much about her and her needs. So please set your pride aside. Go see a doctor. When you go to a doctor, doesn't mean they're going to put your business out for everybody to see. Per HIPAA laws, we have to keep it private. So go seek medical attention, see what you can do, whether it's medication that will help for you, whether it's devices that will help for you, but there is help out there. So for men out there, please don't give up hope. There is help. God bless you.
Thank you so much. It's been an amazing conversation. Please, Dr. Chumisi, can you put your phone number out there? I mean, for those that are listening, in case if somebody don't feel comfortable reaching out to me, because maybe I might know them. And if somebody wants to reach out to you concerning these medications and the things you do at your clinic, please put your number, perhaps your location, and then we can end.
So if you need to call me, you can do that on 0243113504. 0243113504. That same number, you can WhatsApp me on that. My clinic is located at Malam New Babu CP. That's what the clinic is.
Thank you so much. It's been a blessing tonight. I'm thinking I'll talk to you both and see if we should do a part 2, because I still have questions. Amazing conversation tonight. God bless you all so much. Everyone have a good night. To everyone who tuned in, it's a blessing having you. It wouldn't have been possible without you all listening, whether via Zoom or on Facebook. And please share. Copy the link. If you don't feel comfortable sharing it on your page, just copy the link and forward it to somebody. You might never know that your friend who has not been able to confide in you or come to you to tell you how small of a Peter they have, or how small their husband's Peter may be. So do well to share. Thank you so much. Everyone have a good evening. See you next week.
Thanks for inviting us. God bless you.
Bye-bye.
Bye.
Wow, tonight.